There is gathering medical evidence that lockdowns don't work at all. Dr. Matt Strauss, who is an assistant professor of medicine at Queen's University, Ontario, and a former medical director of the critical care unit at Gulf General Hospital in Canada, has written a fascinating piece for The Spectator where he writes, "As a medic, my verdict is clear. Mandatory government lockdowns amount to a medical recommendation of no proven benefit, of extraordinary potential harm, that do not take personal values and individual consent into account. Physicians who call for their use should hearken back to these core planks of their ethical training." And Dr. Matt Strauss joins me now. It was such a powerful piece, Dr. Strauss, and I think one of the lines that really stood out to me was when you said that if lockdowns were a prescription drug for COVID-19 treatment, you say they would actually never be approved by the US Food and Drug Administration because of the harm that lockdowns cause.
Yeah, absolutely. And what I tried to draw out in that piece is that originally we didn't know so much about COVID-19, and so the lockdowns were proposed on the basis of mathematical models, but we would never release drugs to the market based on mathematical models. I understand COVID-19 was entirely new and that's all we had, but now we have real data. We have real data to show that comparing countries based on their lockdown status does not prove that they have any mortality benefit whatsoever.
So why do you think governments, including the government of the UK at the moment, and we've just heard that Wales will be plunged into a 2-week total national lockdown from this Friday. Why do you think governments have put lockdowns at the top of their list in terms of a COVID solution?
The shortest answer, I think, is the madness of crowds. I think that there's a fair amount of panic. I feel like the sense of do something, well, this is anything, we'll do that then, is what's really going on. In my own country, in Canada, generally public health was not in favor of these sorts of things, and it was kind of outraged social media mobs that forced their hand a little bit. So I think in democratic countries, to some extent, we get the leadership we deserve, and it is now time for those of us who are experts to look at the data and try to talk some facts and reason back to the panicked crowd.
And as you say, we have learned a lot now. I know it's still early days in terms of COVID-19, but you do make the point that actually we don't need to rely on these mathematical models anymore because there is enough hard and fast information that we can use to realise these lockdowns are not successful, and they haven't been successful anywhere in the world.
I think that I'm open to new information and new evidence as it comes out. Science is always in progress. What the paper I quoted that was published by Lancet in my Spectator piece is the first and so far obviously the best paper to look at these differences. And so I'm open to the fact that somewhere some form of lockdown might work. But given the incredible harms that lockdown can potentially cause and is causing, we need stronger evidence. We need to prove that it works before we strip people of their civil liberties.
Yeah, and I think it's important we talk about that piece in the Lancet that you mentioned, because it was in August. It was analysis of data from 50 countries, and the researchers found that full lockdowns were not associated with decreased mortality from COVID-19, which is a stunning finding, really.
It's stunning, and I have not seen this paper, which again is published by very serious researchers. I haven't seen it discussed in the press at all. The press is addicted to these mathematical models.
Yeah, absolutely. Absolutely. But actually, is it not about governments looking to scientists to provide them a politically popular answer? Because I have to be honest with you, the population is very scared in lots of countries, including in the UK, which means that on the whole, public polling is very positive about the idea of lockdowns.
Yeah, I think that a lot of that is from media narrative. I think that politicians have the ability and media conglomerates have the ability to sort of choose the experts that they would like to hear from. In discussions with a colleague of mine, I was saying, like, science is not a student council election. The popular scientists or the scientists who make it onto television are not necessarily the ones who are right. And so that's part of why I'm very proud to be part of the Great Barrington Declaration, which was written by very serious epidemiologists at Harvard, Stanford, and Oxford, to kind of say, like, there actually is a diversity of viewpoints in the scientific community. I do think that cable news in North America, I'm not as clear on the situation on your side of the Atlantic, but has peddled kind of a constructed narrative of all scientists agree with one thing or the other.
Oh, absolutely. And they're covering up the Great Barrington Declaration, actually, which I think is anti-science. We had Professor Jay Bhattacharya, one of the authors of the Great Barrington Declaration, on the show last week, and he said that if big tech and if the mainstream media continues not to cover the Declaration and the aims of the Declaration, it actually proves that they're being anti-science. But look, let's just talk personally, though, for a second, because you say you have personally admitted dozens of elderly people to hospital with illness resulting from social isolation and neglect. Some, you say, were literally starving to death, including a patient in her 80s who lived in a retirement community but relied on family members to feed her meals. And when they were banned from the premises, she couldn't feed herself. I mean, this is the heartbreaking personal cost of lockdowns too, is it not?
Absolutely, and the image of that woman coming to hospital with biochemical evidence of starvation will stick with me for a long time. And there are so many more stories that I have. Like, I'm a life support specialist. I've looked after about 8 critical care patients on ventilators who had COVID-19. 8. And all 8 of those were tragic, but it's dozens and dozens and dozens of elderly folks I've seen with lockdown problems rather than COVID-19 problems. I looked after a man who was in a coma from depression. That's called catatonic depression. I'd read about it. I'd never seen it before until the lockdowns, and that happened to him after he spent 3 months completely isolated. I looked after an elderly woman who tried to kill her grandchildren. She had a psychotic break. She was locked in a small house with many grandchildren, and she was initially admitted to psychiatry, but then had a heart attack. So I was seeing her then, and she was saying, "This wasn't me. I would never do that. I don't remember it. My mind literally cracked." So and then so these are real health outcomes that are not showing up on the COVID-19 case graphs that you see on the news. But beyond the health outcomes, there's just suffering and loss of meaning in life. So if you tell me that we can't have a funeral for my father, that means something. That isn't a mortality statistic. If you cancel my wedding, that means something that isn't a mortality statistic. So the worst. So my wife is also a doctor, and she's come home from work crying because she had to tell someone that we didn't let you see your loved one for the last 3 weeks, and they suddenly died of what they were here with. And so you have no chance to say goodbye. And in fact, we're not going to let you come see the body. And she describes those families absolutely wailing on the phone. And she describes that she will never forget that sound. So there's so much suffering and distress that we need to account for.
The absolutely heartbreaking cost of lockdowns, put so beautifully by Dr. Matt Strauss, the